Welcome to the first ever mobile meetup. I'm so excited that you're here. I'm a dental hygienist here in Utah, and we have a really exciting model here in Utah for dental hygienists being able to work in public health. And so everybody always asks me questions about it, which I love. And so I was like, I need to do a little meetup where everybody can learn more about it. And then I think other states are really interested in these different models that are available. And I'm also trying to recruit people. So I would just love more people to be able to do mobile dentistry because the need is so huge and very, very important. So welcome, welcome. We'll do some more of these as we go. And tonight I'm recording this session too. So if you know of anybody who's like, I didn't make it, I'll put it up on the website. If you have any questions throughout, you're welcome to um put them in the chat box, or I have you available. There's so few people, you can always like pop on and ask your question. Okay, so we're gonna go over a few things tonight. What is mobile dentistry, the ins and outs, some of the equipment, and then what are some of the practical tips? Okay, so obviously I'm not like a legal professional by any means. I've just been doing it for a while, so it's really important to always use your professional autonomy and your judgment and read your state practice act on what you can and cannot do. Obviously, I'm talking about a lot here in Utah, but it's still important to like know what the rules are and the laws of the land so that you don't do anything wrong. So for here in Utah, we require the hygienist to be licensed in Utah, but no other additional education is required. The American Dental Hygienists Association just came out yesterday. I see Jen on here, and you printed it out actually for me to look at. But they have a model that you can take what ADHA's legislation has written in their documents, and you just can insert your state information and say, this is what we want in our state too. And that one was for the RDHAP model, which would require additional schooling and 5 years of being a hygienist. So here in Utah, you can start this up the day you graduate, which is really nice. They really reduced a lot of the barriers for us as hygienists to be able to get into these settings, which I really love that model. I didn't realize how important it was until I had it and heard other states, and I was like, oh, there's really some barriers in other states. It's important to know your supervision laws as well. So direct is the dentist has to be on site essentially and has to like check the procedure essentially before they leave. Indirect is they authorize the procedure and they're in the office, but they don't necessarily have to be in the room. General is that they don't need to be present, but they have to approve the treatment plan. So there's some things in Utah that we work under general if we want to do them mobily, but most things are under independent supervision, or in some states, they call that direct access. So those are kind of interchangeable. So I work completely independent, which is super awesome. But there's some rules still that I have to follow. So I don't have to check in with the dentist. The dentist doesn't have to pre-authorize certain things. And so that may vary per state. So here's some of the rules here in Utah. I have to assume the liability though, while engaging in my scope of practice. So the things that we can do as hygienists. Obviously, I can't write a prescription and things like that. So I'm not doing those things. I'm doing things that hygienists can do. And then I have to hold liability insurance. I just renewed mine yesterday. And I marked on there that I have independent practice, and I had to fill out an extra form for my malpractice insurance, which is through Pro Liability. It's the one that the American Dental Hygienists Association recommends. And I had to let them know that I had sterilization process set up and that I referred my patients to a dentist, and they also asked me if I did oral cancer screenings, which I thought that one was interesting. Obviously, because those are probably really large malpractice suits if we don't catch those. And so I had to let them know that I was doing those. I have to refer all my patients to a dentist beyond my needs. And so I know what those are. If my patient has caries, I need to say, go see a dentist. But if they need periodontal therapy, they get to see me, which is really awesome. But I can't do a filling, a drill. I can't use a drill, but there are things like interim restorations, temporary, we call them temporary restorations essentially, or glass ionomer restorations that I could do without a dentist being on site, but I have to have permission. So there's a few nuances here and there. Then we have to be able to deliver all the records to a dentist if I refer somebody that it's beyond my scope of practice. So I think we all know what those are pretty well. And then in Utah, I also have to fill out a few forms. So this is what one of the forms looks like, and I have that in the handout. So this is for Utah, but I have a link in the handout. I also have the actual form here. And it says, my name, my license number, where am I actually working? And I actually clicked all these boxes, nursing home, assisted living. Put school-based program. I don't have a school-based program right now, but if I want to, I just clicked all the boxes and they asked me what health setting name I'm working in. And I just work in a ton. So I just like left it blank because I didn't feel like it was applicable because they wanted the name of the place and address. And I'm like, I'm going everywhere, right? There's also an affidavit of release. I just read all these to you. This is I will hold liability insurance, liability for the work I own, refer my patients beyond dental needs, and deliver all dental records to the doctor, which my dental records are intraoral photos and my chart notes. And then, you sign that, and then they keep that on record at our Department of Licensure. And that's all you need to fill out. So there's some places like California, like if you want to be an RDHAP, it's extra schooling and 5 years before you can even start something like this. So super awesome that they reduce these barriers here in Utah. So I can work in a nursing home, assisted living or long-term care facility, a community health center. And some of these are a little bit vague, right? What does that community health center mean? Like, could I set up shop in my senior citizen center? Some of them, you have a little bit of autonomy there. A federally qualified health center. We have actually one here where I live in Orem, Utah. You can set up in a school as a school-based program. So any Head Start, any preschool, any little home-based preschool, any school program you could set up. Any individual residences for the homebound. I crossed that out because this last year here in Utah, they removed the word homebound and put non-ambulatory, which just means they can't walk. But I will say some of my patients are homebound, but they still can walk. So, you know, you kind of sometimes they leave them a little bit broad for you. And then, or just a part of a mobile dental health program. Those are you have to be mobile. So you'll notice none of these say that I can have a brick or mortar building. As some people are coming in here tonight, welcome, welcome. We're going to continue going, but if you have questions throughout, let me know. So I can have a brick and mortar building. For example, in Colorado, they have a similar model where there's really no restrictions. You can start doing mobile dentistry like the day you graduate, but they can have a brick and mortar building. In California, if you're an RDHAP and you get an advanced license, you have to apply for their advanced license and take a course. You can have a brick and mortar building in designated areas. And so here in Utah, I cannot have a brick and mortar building. And if I want to take radiographs or do injections or intraoral scans, like with an iTero scanner, I have to work under general supervision for those. So a dentist has to approve that I can do those things before I can do them. So personally, I don't have I collaborate with a lot of dentists, but I don't have like a specific dentist that I collaborate with exactly. But I don't do radiographs right now, but I could, but I'd have to have every radiograph approved. So I'm just sending my patients to a dentist, once a year or whatever it might be, however often they can get out to get those radiographs and exam done. And then I just request the radiographs back from the dentist. So I'm letting the dentist take those because I don't want to have to ask permission every time I go see a patient. It's just a barrier and a limitation. They might say no, so I have not invested in that equipment, but you definitely can. Injections, I could ask a dentist if I needed to do injections. I have a dental pain synapse eraser and I have like gels and things like that, topicals that I'm using. So I haven't, uh, that just passed here in Utah in May that we can do injections under general. So I haven't actually had a patient who's needed that yet, but that is a new option and exciting for us. They put this under intraoral scans too, because they didn't want companies coming in just having assistants go around doing scans without a dentist. And so they put those in for large like DSOs coming in and trying to do those interesting things. So on your handout that I posted in the chat box, if I'm just gonna post it one more time in case those coming in can't see the past chats. I have listed on there all of the things you need to start a business. And I know that might sound really scary. I've started 3 businesses now, and let me tell you, you can start a business in about 30 minutes. It's pretty easy, but I know that sounds scary, but it's pretty straightforward. The hardest part is going to be choosing a name for your business. And it's really important to make sure you have the business. So in case something legally happens, you don't lose your house, right? You're only going to lose maybe things from your business. They can't go beyond that. So keep that in mind. So there's you have to get a business license in your state, register that name with your state, make sure the name is available, and you'll want to talk with a legal person on if you should start an LLC or an S corp. I don't know all the ins and outs of all of those, but all of mine have been LLCs. So you'll have to ask, sometimes people will ask like a legal professional, which this is my idea. And you might have some bigger ideas than I have this evening. I'm hoping to inspire you a little bit. And they'll tell you what you will need to start. And then, of course, you have to report your income and your taxes. I just take all my information at the end of the year. I give it to my accountant that I've been tracking and organizing in all the different areas on things that I've purchased and my equipment. And then they do all my taxes for me, and I've just paid them money. So it makes it really nice. And then obviously you have to pay taxes, sales tax, and then government tax, those types of things. So it's important to know those. So I put some links on there so you can have resources for those. They always have little videos for you to watch and understand those things. You'll also need an IRS EIN number, and this allows you, to be paid as a business. Sometimes when you fill out forms, they'll ask you for like an EIN number or a social security number. With a business, you'll always fill in your EIN number to be paid. And then you need to open a business bank account. Mine is through Zions Bank, but most banks have a business offering. And you'll open that account, then you can receive payment and things like that. But you have to have that business license before you can open the bank account. So there's a few order of things. And then you have to get a local business license. So here in Orem, where I live, uh, with my city, I have to go get a little city business license to be able to operate within my city as well. So there's a state business license and a city business license that you'll need, and then in a bank account. Once again, those links are in the handout. And then secure liability. So of course I have just practicing liability insurance, and I tell them I'm an independent practitioner and it's a little bit more money than when I just practice underneath a dentist in an office. So keep that in mind. Mine's about $250 per year, so it's a little more. And then I do know that like if you have a business, there's also like business insurance. So let's say your chair breaks and your patient is in your chair and it's, not malpractice, but somebody got hurt on your equipment, then there's business insurance that could be filed if the patient gets hurt somehow. Nancy asks, you have an Orem business license. Do you need a license for every city that you work in? No, just one. Just the city that where your business is based. And mine is a home-based business, so it's just my personal address because I don't have a brick and mortar building. And then, of course, once you have all that set up, then you fill out that little form and notify Doppel that I'm practicing in these certain settings. And then, Miranda, do you need both the business liability insurance and the one we usually carry? And that will be up to you. For sure, they do require you to have the like pro liability insurance for, missing something on an oral cancer screening. But To have a business insurance, that'll be up to your decision. You'll have to decide for yourself. But it is recommended to have business insurance. Like sometimes people will say like we're licensed and bonded, like when I worked for this cleaning agency, they would say I'm licensed and bonded, and that just lets people have more trust in you that if something goes crazy and you break one of their chairs or the bed somehow because you're gonna hoist yourself up on their bed, like there's, some coverage there beyond your malpractice. So I am just telling you that is out there, and most bigger companies have something like that. So depending on how big you want to go, you might want to do some type of insurance like that. So next, let's talk about patient forms. So this form I have in your handout. This was given to me by the Utah Dental Hygienists Association, and it's just informed consent. I have to give this to all patients to sign by the responsible party. Most of the time, my patients, they have someone else has their power of attorney, so they're signing it for them. And every patient has a record of one of this. So just I have to tell them I'm a dental hygienist. I'm working within my scope of practice. I'm not going to come in and drill on your teeth, and I'm going to do, follow the rules and refer things beyond my scope of practice. So just informing them of the type of treatment that they're getting, and they sign that, and I keep it in their record. How do we get paid? So currently, I do just a direct pay option. I don't take insurance. I just do like a business Venmo, or I can invoice them through my bank account, or sometimes I'll just have them, sometimes they like to send me a check or give me a check at the end of the appointment, or some will give cash. So everybody's a little bit different. And I just let them know up front, like, these are my fees. This is what I'm expecting the day of. But you definitely can take insurance. There's a hygienist in St. George, and she does like an out-of-network plan, and she can take insurance that way, but she can't, it's kind of a roundabout, but she can't like be in network. You know how we're in network in different dental offices, and you contract with the insurance company, you can give a cheaper rate. Like we can't yet do that. So we're working towards getting direct reimbursement as dental hygienists for our work, but unfortunately, that's a little bit of a barrier for us. But you can take like an out of network billing insurance, or the patient can sometimes take your invoice and then submit it to their insurance. Can we bill for Medicare if we register with them? I'm not sure how that works. And you can bill for Medicaid here in the state of Utah and get direct reimbursement that way. I actually found out we could do this a few years ago. So I went through the application process. Sometimes I have one foot in front of the other before I'm ready. So I got everything ready. I applied, I got approved, and then I was like, okay, where's the Medicaid patients? Like, who I didn't have a Medicaid patient even at the time. I mean, I'm sure I was on some list, but nobody reached out or contacted me. So then it didn't get used, and so they were like, "Well, we're gonna take you off because you've never used it." So I would make sure you have Medicaid patients in some way to be able to get reimbursed. So that was, sometimes I just like to do before I think through all the things. That's just how my brain works sometimes. I'm like, I'll just figure it out later. I just want to get it set up. And then, that's how I learn how I do things. But everybody else might do it a little bit different. They might say, I'm going to find the Medicaid patients first and then sign up for that. So obviously we need to make a living as dental hygienists. So these are some of the fees you could charge. Cleanings are from this to this. Fluorides are from 10 to 40. Any type of screenings or cancer screenings. Quadrant scaling, you could charge, 100 to 140 per quadrant. Perio maintenance, $60 to $80 radiographs. SDF. For a dentist, there's a dentist who will actually come to my patients if they need work and they really cannot leave. They charge anywhere from $250 to $400 travel fee just to show. Oh, sorry. Let me put you on mute there. Unless you have a question. Solange, let's see. I'm so sorry. Where's my little mute button? Okay, so then with that, so let me push the button. Perfect. And then how do we like schedule patients and like have digital forms? The one I have used is Teledentix. And it's like $125 a month. It's like a Dentrix. And so you can send all your forms digitally through a text and have, because sometimes I have like the power of attorney lives 3 hours from the patient. So they don't always come in when I'm treating the patient. So it's nice to be able to send them all the forms, they fill them out digitally, and then I have them in the computer. This allows me to put in my probe depths. It's robust. It's like Dentrix. All your radiographs, all of your um, intraoral photos, all the health history, notes that you can then send to a dentist. And that's a great way too. There's also Teledent. It's not quite as robust, um, but it does have like some basic needs. And then there's like Curve Dental, Dentrix, EagleSoft. Those ones, they're a little bit more expensive. But if you maybe work with the dentist that you maybe already work with, maybe you can utilize their program and take it mobily. So, like maybe you could kind of bridge between what your office is doing and say, hey, let's have a mobile program just for our office and maybe use their programming. So, because they're a little bit more, they're a little bit expensive. So that's one of the costs that you'll occur. And then let's talk about some of the equipment here. Sometimes, in some states, they have a mobile van. I didn't choose to start out with a mobile van. We can be mobile, right? So you could definitely have a van here in Utah, but you can see here they're from 150 to 500,000. But there have been plenty of people who invest in these, and they see quite a few patients, right? Me personally, I'm not seeing that many patients, so I was like, I don't think I want to invest in a van right now. But this is a long list here of people who actually already make these mobile vans. They're available, and you can go to the school, and kids could come out and see you. You could go to the nursing home, and people can come out and get into your van. For me, I started in nursing homes, and a lot of my patients, it's really unsafe to move them. And so I like to just keep them in their room. So for me, a mobile dental van didn't quite make sense. But if you are, working in school settings, preschool settings, it might be nice to have some type of dental van and then have everything available for you. Because currently I am taking everything out of my car and into the building and setting up my chair in there. And that's a lot of work. But if you had your sterilizer and everything all ready to go in a van, that might be a route that you would like to go as well, but a little bit more costly. So, what equipment do I have? I personally have this little black one in the middle that has the yellow bins on it. It was from Home Depot, but there are dental companies who make these and they're really nice. I first started out with just a suitcase because I was like, am I gonna like this or am I not? So it's probably a little ghetto in the beginning. But I packed up all my equipment in there and took it with me and wheeled it in and it worked really great. And then as I made more money, I invested in something that would carry all of my equipment wherever I was going, has little drawers, I can wipe things down really easily. And I do really love having that mobile cart. I can set things on it and it just makes it so much easier. And then up top here, sometimes as you get more things, you might have to make two trips. I love when when I have a patient, I only need to make one trip for. So, but you can see, you could get some type of card that will fit many things on to take things in and out. And sometimes I'm having to park far away. Sometimes I'm having to go up some stairs. Like sometimes getting your equipment into the room is a little more tricky. But those are some options. Like I said, dental companies make it. You can buy some at Home Depot. You could start with a suitcase that you already have in the closet. That would be great too. The middle chair right here, this little zero gravity recliner, is the one that I use. I saw Danielle just pop on. She had somebody adapt one of those for her so she could reach ergonomically into her patients, which I love. I have not adapted mine yet. So my patient, you can see here, she's tipped back in that chair, nice and cozy. I will say half my patients don't even ever make it into that chair because they can't even move from their bed, or I don't want to move them out of their dental chair. It's really unsafe for me to move people. and I don't want that liability. So I'm like, we're treating you right in your dental chair. And if you're thinking, Shelley, ergonomically, how is that working? It is painful on the back, and you have to do lots of yoga poses, and I have to kind of spread my legs wide to get kind of into the area and like at their level. Sometimes I can get my dental chair, there as close as possible, but it's a lot of twisting and moving in different directions. And so it is a little harder on the body when they are not in the dental chair. But my ergonomics, you can see in this other one, look great. I do have to reach my arms out just a little bit, but it's really handy and easy and really lightweight compared to like some of the other dental chairs that are made out there. So it might look a little, you might be thinking, I don't know, are my patient's going to be like, what's happening here? This is janky. I just say, come get in my cushiony chair, and they jump right in. They haven't had any issues with that. And I do like how lightweight it is. So Danielle needs to market these and make a whole bunch more. I would love that. But you can see there's a lot of different dental chairs. This one on the far right is a company called Floss Time, and they like set up for a week in a business and do a bunch of work there. We cannot do that yet here in Utah, but if we change that in the future, maybe we could do that as hygienists where we set up in a place and we stay there a little longer. I could set up in a nursing home and stay there for a week. I could, contract with them. Like there's so like the sky's the limit when we're thinking about these things. There are some barriers because sometimes these things aren't always uh I guess you could say reimbursed by insurance or whatever it might be, but you could definitely set up for a little bit longer and have patients cozy and whatever it might be. There's so many different options. These are the clinician chairs. So I have one from Crown Seating, and they just sit you up a little taller so that you can reach your patients. So I really do like having a dental chair. Sometimes I don't even take the dental chair in and I'm standing, or the other day I was kneeling because my dental chair wouldn't go low enough and my patient's chair was really low. So I'm like, I'm just gonna have to kneel for all my surfaces towards. My knees did hurt a little bit. Sometimes I'm jumping up on the bed because they cannot move out of the bed. So I'm trying my best to get up to my 12 o'clock there. My surfaces away were going to be a little bit more challenging for this patient, but we couldn't move them. So um, sometimes that's a little bit of a challenge, but you still can do a really great job and really great work for them. I have a portable suction that I'll set right here on the bed by the patient and treat them. So when I first started, I was like, do I really want to invest all this equipment? Do I even know if I'm gonna like this or not? I literally my suction, because everybody was like, what did you do for suction? I had one cup that had a straw with water in it, and the other cup that was for spitting. And I bought nice cups that were styrofoam, and they had a great like hold to them. And they looked cute because I knew it was going to be kind of ghetto, right? But that is what I used actually for the first few months, and it worked fine. The only patient who complained about it was my patient who was a hygienist before. So she was like, "You really need a suction," and I was like, "I definitely do." And then I thought it's time to invest in a small suction, which we'll talk about here in a second. So I literally started with a cup of water and with a straw, and then they could spit into the cup, and that actually worked. So if you're just like, man, equipment wise, like these patients are not getting any care, so I don't always want to say that something is better than nothing, but I do want to say I'm doing a really great job with their oral care. They just might be adapting the spit option, you know what I mean? Like that's not detrimental to their health that they spit into a cup, you know what I mean? But getting care and the right care and the scaling and the amazing things that we do for caries prevention, that is what's important. And you're doing a good job with that. So keep that in mind. So I first bought this Roscoe portable suction. It was like $250. And then I had this little squirt bottle that I would wrap the end, and I never actually put it in the patient's mouth. I kind of hang back a little bit and I squirt it into the patient's mouth. And I do love my Roscoe suction still to this day. I attach a blue boa to it. And then I have one that has a slow volume suction, and I have one that does fit a smaller, like one of those little rounded curly Q suctions. I can't remember the name right now. But so I have a few different options there, and it's so quiet and it's chargeable, so rechargeable. So I don't have to have it always plugged into the wall. in case I'm not by an outlet, because sometimes with all my equipment, my ultrasonic and my bigger suction, like everything has to be plugged in and then I need a power strip. And so there's a lot more things to think of. But this one's just so tiny. I can just put it right there on the bed when they need suction. They can suction. I'll give them a little bit of water because my patients personally, I'm afraid of aspiration pneumonia. They can't handle a lot of water, but the suction is really important and great. The patients really do like that. So the portable suction, if you're thinking, okay, what are my minimal costs, Shelley, to go see patients? I really love this Roscoe mini suction. And if anybody here is in Utah County in this meeting, I would welcome anybody to like use some of my equipment and go out and see if you even like it because it's just sitting here a lot of the times when I'm doing other things. And I would love to share and have someone else utilize it. So there's a lot of different options for portable suctions. You can see here, I have the one on the lower right-hand side. It's from Aseptico, and it has a, water bottle and the suction, and then it has high speed, low speed. I have a portable polisher, so I don't really actually ever use the low speed, but air, water, and suction. And, it's pretty heavy, but it gets the job done when I need something a little more robust. It also connects to my ultrasonic unit and I can scale patients with it great, but it is noisy. That is the downside to it. Sometimes I feel like it's really scary to some of my patients. So I turn it on and then as soon as I can, I turn it off because it's just a little bit loud. They do also have these smaller like backpack ones that might be great. I don't know much about them, but there's a lot of different options that are out there and available for portable suctions that are pretty inexpensive. This one from Aseptico is like $10,000, but I've seen them, smaller ones a little bit cheaper. As I mentioned, my Roscoe suction one is only $250. So that might be a good place to start until you're like, I want to go big time on this. These are ultrasonic scalers that are available. These ones have like independent reservoirs. So if you have like a Roscoe suction and you don't have a unit that has, water in it like my Septico does, you can fill this with water, the chamber, and then you don't necessarily need to plug it into an aseptico unit. So you could buy one of these and still ultrasonic scale, but use the smaller suction. And because my patients choke so much on the water, sometimes I don't use my ultrasonic scaler every time. I'm bringing it in case I do need it, but sometimes I'm like, you can barely swallow. You're so elderly, I can't tip you up. I can't, if you needed to cough, like I couldn't sit you up. So sometimes I'm doing hand instrumentation and, a toothbrushing and polishing and getting off all the calculus and debris that way. But so keep that in mind if you're like, I don't have time to buy an ultrasonic unit. I don't have the money right now. You can hand instrument with some of the school, the instruments maybe you had in school or whatever it might be. Take a kit out. These are portable polishers. So if you don't have a huge mobile unit, you can invest in a portable polisher. They're available out there. I have a young one and I also have, what's the other one that I have? I think I have the Aero Pro from Premier. And I like both of those. They just, you have a little pedal and you're pushing it and it goes on the ground and you're polishing the teeth. You could do dental x-rays. Our state makes it so that you have to have a dentist approve those before you can take it. And so I never invested in the x-ray equipment because, it's really costly and having a sensor and things like that. I would love to have one. But if you're, especially if you're doing more teledentistry and maybe if you're working with your office and you're having a little outreach branch, taking one of these is super important. Using that teledentistry to do an exam, right there in the chair for the patient. I think x-rays are super important. So over time, I'd love to add these in, but they created a barrier for me and all the hygienists in Utah when they took it back to the supervision where we need a dentist to approve these. Okay, what will you be what do you do about disposing of fluids? So do you mean after like I suction, Letitia? So they go into this little container. Let me go back a little slide. And I just put them in their toilet. So this one right here, this has a suction inside of it. And same with my Roscoe one. It has a suction, all this is where the saliva goes. And I'll just put it in the toilet and then rinse that out with the soap usually that's in their sink. And then, cavi wipe that all down because it can be sterilized. So the plastic would melt. Instruments, whatever instruments you want, you could use. So I'll just leave that at that. Everybody's preferences. And that's the nice thing about having this autonomy to do your own thing. Having my own business is I get to choose what instruments I like. So that's handy. And when they're dull and when I need to buy new ones, and I really take care of my instruments because they are my own, and I'm really making sure that I don't want to have to buy equipment when I don't need to. I use my light on my loops. And actually, these are my ergo loops, but most of my patients have to sit up a little bit. So because of that, I actually like my regular loops, the olden day loops, because then I'm not like sitting so far backwards to see my patients. But there's a lot of different like lights that are available and out there if you needed to do that too. And then, yeah, ergonomics can sometimes be a little bit tricky. Like the other day, there was this bed and I could not hoist myself up on it. They were propped up a little bit. There was a wall, and so I needed to get like up on the bed, the back side of the bed. So like my foot was against the wall and my like ribs were up on the side of the bed, and I was like holding myself up with one foot behind me, doing all of my ways, and I was like, I probably look like some ballerina up in the air up here. And so I would say ergonomics are quite a challenge. I try my best to really like, have a good core, not just leaning at the hips. But it is pretty exhausting having to carry everything in and then doing all of the, there's some bending and twisting that happens. So I usually, my max is probably 3 patients a day. And then I'm like, I'm just pooped ergonomically. So that's for my patients though in nursing home settings. So if you're seeing kiddos in a school-based program, junior high, elementary, high school, like I feel like high school students get left out so much. They would really benefit from a program like this, that your ergonomics can be better when you have a great chair. So then you can see more patients. Make sure you're always following the OSHA, transport of instruments. You have to have something that's leak proof. I put everything into my kit into leak proof containers. You put the biohazard symbol on top, and then instrument sterilization like normal with heavy duty gloves and putting them through sterilization. And usually you can either buy your own sterilizer. I've seen some hygienists where, like in Colorado, there was one, she has it in her garage, and she comes home and she processes her instruments in her garage or in a special room and space in their house, or if there's a mobile van in the mobile van, or you can contract with an office to do your sterilization there. You just want to make sure that whatever place you're contracted with, that they're testing their sterilizer, and make sure that you have that collaborative agreement. And then this is the Enviro pouch down here. They're reusable sterilization pouches, which is awesome. You can't see through them though. That's kind of the bummer thing. Sometimes you're like, wait, what is in here? I'm gonna have to guess. Or you can buy certain pouches, certain colors for certain products that you have. And so that might be an option for you. And then you tape them shut with like the tape that goes different colors when it sterilizes. Or you can just buy your own bags and you can sterilize that way. So, with that, what questions do you guys have or concerns? Um, oh, Miranda asked me, do I carry a power generator in case there aren't the amount of outlets needed nearby? And I do not. I probably could, but usually when I'm in their room, I do know that since they're in there, there's got to be power. And so I definitely um, will bring an extension cord sometimes on my little multiple cords. What are those called? The yeah, where they have multiple plugs, depending on the how much equipment that I'm taking and needing. And then like if you're at a school, most of the time they're gonna have a plug close by. So I have not needed, I'm trying to think of anybody else that I know of. I haven't ever heard of them too much having a generator, maybe unless you have like a bus of some sort where you need a generator. It's like a food truck, you might need some type of outside generator. Yeah, how do you find your partner or your patients? So personally, I try not to see too many patients right now because I personally I'm a busy girl, but I still love to see my patients on my breaks between when I'm teaching. And so I have not done too much marketing. But if you want to find patients, definitely sending an email out to any care facility, if that's going to be your spot to work, or any school, you can go in and contract with the school or a school district and be like, I want to come in, I want to do this program. What do you think? I could get it up and started in 6 months. So if you have the contract set, then, maybe you can think through the process then and like get the consent form sent out and which you can do via teledentics, and get parents to sign that paperwork so you can go in and treat them in schools. And so, the sky's the limit when it comes to marketing. Word of mouth, you can also let dental offices know, hey, if you have a patient who you can no longer care for, then call me. So I haven't done much marketing to different dental offices, but that is mostly how people have found me. Like it's mostly my past students. They're like, Miss Brown, I know that you have a mobile and I have this patient who can no longer come to see me or they're on hospice. So can you please go see them? So mostly mine has just been by word of mouth. And I really I've tried not to advertise, but that's why we need more people because I would really love to be able to be like, My friend is on deck all the time to go see patients." And so, the sky's the limit when it comes to marketing and finding patients and I do find, like I was talking with a nursing home recently, and he was like, I'd love to have oral health for every one of my residents. Like I would love to have a dental hygienist like on staff because we know that if, they have great oral health, then they're going to live longer and have a better quality of life, right? But he was like, the cost, the cost. And I was like, I know, I get it. So sometimes people, across the country have gotten grants. I know everybody's like a grant, that's another step, Shelley. But that's a possibility if you're like, I really want to do this. And if I had a grant, then I could be at this nursing home full time and we could see all the residents and we could take some data and we could show that this is a really amazing opportunity to have somebody on staff doing oral health every 3 months on these patients or brushing. They just don't get their teeth brushed well every day. How much better we could make their whole body. So it'd be interesting to do something like that. But that's how I work marketing. Can you treat patients' family members or strictly within the settings outlined by laws and licensure? Every time I go see a patient, their caregiver asks me, which is very honoring. It was a great honor. They always say, "Can you see me too?" And I say, I can't see you in this setting, but if you come see me at the place that I work with the dentist, you can. And they always say to me, that's really sad because I'm here with my family member all the time. It's hard to break away. It's hard to take care of my own self because I'm here most of the time taking care of them. And it's so challenging. And I would love someday to be able to help the family members out as well because they really are going through it at the same time. And so someday we'll be able to do that, but because of the laws right now, we can't. So hopefully we can get that changed. Yeah, how do you market yourself? I had done a lot of marketing in San Diego at the nursing home, and I have a different time to get in, and the facility is very different to let us in, 100%. Every facility is going to be a little bit different. So if you can find one that like has multiple places and maybe market with them first and say, hey, this is a great idea. I could service all 5 of yours. What do you think? We could do a lot of teledentistry. Here in Utah soon, we'll be able to do restorations. And so we could do a lot of smart restorations so they don't ever really have to go see the dentist. Wouldn't that be really amazing? Smart restorations on kids as well. So a dentist could maybe approve it from some, teledentistry. You could do it. There's going to be some interesting things going on. But yeah, that's one maybe barrier that people find is that, I love being a clinician. You're like, I want to go in and do the work, but now I have to go in and, market and find all the patients and things like that. So there's some legwork. And then, yeah, what is a smart restoration? I can't wait here in Utah to be able to do smart restoration. So that stands for Silver Modified Atraumatic Restorative Technique. I know that's kind of a mouthful. So this is something I'm super excited to be able to do here in Utah once we can start doing fillings. Actually, you could do a palliative smart restoration now, but you'd have to have approval from a dentist. Palliative meaning temporary. What you do is you place silver diamine fluoride first, which I place a lot of that because it arrests caries, but you always have to be careful with what you say in your notes on how you place things because that would be a fluoride varnish, hypersensitivity type of thing because I can't diagnose caries. And so you place the silver diamine fluoride and that hardens the dentin twice as hard as it once was. And then you can do it same day potentially, but it might turn a little bit dark. And then you place a glass ionomer or restoration over the top of that, and then you have a restoration that's either temporary or can last them long enough until we can get them to see a dentist to have something more permanent done. And so that's called a smart restoration, where you put silver down first and then you place a glass ionomer over the top, which is kind of cool. So I do a lot of silver diamine fluoride for prevention. One of my goals was, well, what I found out pretty quick on my patients was they're not getting their teeth brushed very well, if at all, and they can't get to the dentist. I hear this all the time. We just can't leave. My patient, they can't walk. I can't get them out of bed. They can barely open their mouth. And so what can you do for prevention? And I was doing a fluoride varnish forever. And I was like, that's all I can do. And fluoride varnishes prevent caries 40% of the time. And then I learned about povidone iodine. So povidone iodine is betadine underneath over the counter. You can buy it. You put 8 drops in a cup with a contact applicator and you wipe it on all the teeth and kind of push it into some of the higher risk areas. And then immediately after that, once you put it on, you wait about 10 seconds with their mouth open. 10 seconds. And then you have them spit into the little cup you have or the suction. And then you can place a fluoride varnish on right after that. And that will reduce caries 70%. So if we kill the strep mutans with the povidone iodine, and then we place the fluoride varnish, they work synergistically together to greater prevent caries. Also, if you place a silver fluoride on high risk areas preventively, maybe there's not caries there yet, then you can also prevent caries if you do it if you do that about 70% of the time as well. So personally in all my patients, I do a little dab of silver diamine fluoride interproximally and on any root surfaces and on any crowns on the posterior teeth because those areas, where nobody's really seeing. I still want to have them keep their beautiful smile. So currently I am using a nano sodium silver fluoride called Clear Defense on the front teeth because it won't turn the areas dark, but it has some prevention. It's not quite as good as a silver diamine fluoride. So that's what I'm currently doing for prevention because my patients, I don't want them to ever get a cavity again. And then can I order these things directly from distributors? And some of them you can. And you can set up if you have your business license and you give them your license number, most of them will let you order directly from them. I have not had any problems um, not getting an order, or you can work with a dentist and say, could you order me this product because they won't send it to me. But all the products that I've found so far that I'm using, you can order direct as the dental hygienist. And you could get a rep, you could ask a rep in your area and say, I own a business. I'm running a mobile dentistry business and I have a license and can I order from you? And then Amazon has a lot of products too. So like I get all my gauze off of Amazon, my gloves, my masks, just a lot of my equipment I get off of Amazon sometimes. That's for my patients. So that's how you can do that. Any other questions? If you want to pop on, you're welcome if you have any dying questions. No pressure though. Okay, sweet. I think I got all the questions over here answered. Families. Okay. Letitia, can I ask you what your state does right now? Do they have anything like this going for public health?
Yeah, so I have my PhD and I started looking a little bit more into it. And I found more recent write-ups on it, and it sounds like it's very similar to what you're doing.
Hmm.
So I can be in federally qualified um, healthcare. That was the word I was
Health
looking
centers.
for.
Uh-huh.
Health centers, nursing homes, long-term care facilities, and school-bound. We can do x-rays that I
Awesome.
saw, and it basically outlines that we can do prophies. It got a little confusing with like the periodontal treatment and stuff like that.
Hmm.
Yeah, I definitely have to do a lot more research on it because I have a lot of questions about, I think, the logistics more so.
Yeah, I think the thing I was concerned about the most was like, what if I have a ton of calculus and like I have to do quads and I definitely have all my patients, they bleed, they have so much biofilm. I have one patient with quite a bit of calculus, had quite a bit of calculus, but now I'm coming every 3 months. That doesn't build up quite as much. And so, do you reschedule those patients? Are you just doing it? I do just get it done. I go quad by quad and if they have a little bit more, if they had a ton and I just did not have the time, like yeah, stop and do one quad and then say I'm gonna have to come back for the rest. I was fearful of like having to come back, but patients have been really receptive to be like, I'm not doing anything. So yeah, come on back. And they usually don't mind. It's really nice to be able to set your own schedule and your own fees. And at this point I'm like, take it or leave it. I can't work for anything less. So that just have to set I want to make the same wage I would if I was working in a private practice. So, you just set your fees like you would in a practice and then, essentially and sometimes it's hard to know like beforehand, like if my patient needs quad scaling, should I pre-tell them $1,000? Usually I'm always adding things on. Honestly, like if my patient has a bunch of carious lesions, I might say, you need to go see a dentist. I can help these areas out until you get to see a dentist by placing a silver diamine fluoride on there. And, those are extra money each time. And they're usually like, yeah, let's do it. So it's okay when tell them your base fee. And then from there, you can just tell them what it is. And sometimes that's a little bit scary when you're like a new provider or clinician, but that's what we do in private practice too. So I think that
Mhm.
that's totally okay to do.
Yeah. I had a thought and then it totally slipped my mind. When I first read about it, it sounded like it was more so that you could do like a lot of education and screenings.
Hmm.
And then I kind of went down a rabbit hole and I found a different forum online somewhere, and then that's what kind of outlined more of the treatment that we can provide.
Oh.
Um, so yeah, so I definitely want to, this was really helpful to see how you're making this work and what
Mm-hmm.
you're doing.
Yeah, I think the biggest thing is we always are like, I want to do it, but it sounds a little bit scary. So I'm just giving you all permission to start really little, just start with the cups and a suitcase, and you already have the equipment and maybe you're already working for an office where you can sterilize some of your instruments and take it in. Because I know you're going to do a great job. And sometimes we're just like, we don't have the, air powder polisher and we don't have a laser right here and all the things, but even hand instrumenting and removing all the calculus that way is going to make a big difference. I'll mention too, I always have to start with a toothbrushing. There's usually always so much biofilm, and I use a product called Live Fresh. It has a decamil in it that helps make the biofilm more slippery and come off a lot easier. And then I can see the teeth, and I'm not doing as much because sometimes I'm not always using my ultrasonic. I'm not doing as much biofilm removal as I'm scaling. I don't like to use my scalers for biofilm removal because of ergonomics. I like to use my scalers for calculus removal. And so I do find that toothbrush start with makes a big difference in time too. And then I can get really good like intraoral photos and spot caries easier, calculus easier. And so I'm always starting with a nice thorough toothbrushing and interproximal brushing. So
Mm.
a lot of my patients, their papillas are, the papillar embrasure spaces are bigger. And not embrasure spaces, but interproximal brushes, Wilkins now says they're boss over floss, especially unless you have tight teeth, like a teen, young people. The still floss is great, but anywhere you can fit an interproximal brush, that removes more biofilm. So I'm brushing and then I'm doing an interproximal brush, and that saves me so much time on instrumenting. And there's usually just gobs of biofilm everywhere, to be honest, in the beginning. So that always helps me. That's one of those little secret tips.
I think sometimes it's important to remember to like you're helping them. So however you're leaving them is better than where they started, especially if they're not receiving frequent care.
Right. And sometimes where I was like, I was standing and I was leaning, was I not doing as good of a job? And let me tell you, I like to do a really good job. I don't want to leave any calculus. I'm not, you're not going to do a crappy job. I want you to have confidence in your skills because I was a little fearful at first too. Like, am I going to be able to do a great job here? And yeah, you are. Like, all the calculus gets removed and there's quite a bit of bleeding. Oh, I should say too, I love using the Hibenex product, Perio DT, because it just dehydrates that biofilm and bacteria, and it keeps the bad bacteria, the P. gingivalis, low for 365 days. So, like in my opinion, P. gingivalis is in my Alzheimer's patients' brains, So I'm like, if I can get rid of the P. gingivalis for 365 days, then wow, I'm going to use it. Obviously, I'm going to see my patients every 3 months. So it's just a liquid you put in the gums, you leave it on for 10 seconds, you're rinsing it off, and it reduces the bleeding, kills the biofilm, and it's an amazing, amazing product. If you're not even using it in your private practice, you should be. I know. I need a list of products. I'll put them into the handout by tomorrow. Okay, I'll list all my products in there because I did not do that. And then Miranda asked, "Okay, this is going to sound ridiculous, but how do you position yourself to brush someone else's teeth?" Great question. I'm right there by their bedside or they're by their chair, and I just position them just like I had a sickle scaler in my hand, and I'm brushing all the areas, and I probably spend a good 4 to 5 minutes brushing and then another 2 or 3 minutes with the interproximal brush because there's usually so much biofilm on patients in nursing homes. Obviously, if it's a little kiddo, if you're treating kids, it's probably going to be a little bit different. But yeah, it's just like you can grab your mirror if you want, but there's some leaning that has to go on. And the Perio DT product is what that one was called, Nancy. I'll list some products that I use. What do I charge for Perio DT? It costs 25 or 15. I think it's $15 now to buy. So you always charge 30% more of what you buy it for. So you can charge $25 if you want what you bought it for, or you can charge $40 and make a little money off of it because it's a really important thing. But yeah, the two, it's the same thing, but one brand calls it Perio DT and another brand calls it Hibenex. And yeah, make sure you follow the directions when you do place it because you don't want it going anywhere other than the gingiva. You don't want it to get on any other tissues, and you don't want to really, I always give a double rinse if I'm going to use any topical afterwards, because I don't want it to interact. But super amazing product. In private practice, Perio DT, some are charging $100 for one syringe, and one syringe can do two quads. Before you scale, you should place it, and after you scale, it's supposed to do both. Lowers the MMPs, all the inflammatory mediators. It removes the smear layer. When you're scaling, you leave a bunch of gunk all over the root surface, and the junctional epithelium cannot reattach back to it. So if you remove that smear layer, you're going to get more attachment. It's just really an amazing product. So if you're not using that one's great, but I do love it for mobile practice as well. All right. We have about 2 minutes left. So does anybody else have any dying questions? If not, you can always email me afterwards. Care@Shelley.Dental, or you can find me on social media because that's probably how all of you are here because you know me on social media. And thanks for being here. It was fun to learn with you, and I hopefully we can share more. I'm always trying to recruit more people to do mobile dentistry because there's such a big need of these patients, and my goal is to have a dental hygienist in every nursing home or care facility, at least on staff, that's helping remind others about oral health and making sure these patients are getting care. So. And then, yeah, Tamara, you should definitely email me because I always want more hygienists. I definitely have some patients who need to be seen. So, yeah, I would love to. If anybody needs a little more one-on-one, you can come out with me and see a patient. I know, Letitia, you live super far away, but if anybody's in the Orem area, if you're like, I want to go see like the process and see how it is, I feel like the first year was like a little scary every time I went, and now I'm just like I could do it all day long. Like you go in, I sign in at the front desk, their family member meets me there. I'm not really telling the facility much that I'm coming. I do call if it's an Alzheimer's place and say, I'm coming to see this patient. But if the family member meets me there, I'm, just meeting the family member. I have to sign in at the front desk, but usually I don't have to inform like a nurse or anything else. But it's super rewarding. The very first time I ever saw my first patient, I cried at the end because I was like, this is how hygiene should be. It should be where I got to choose all those things that I did on my patient. I got to choose how long I took on my health history, my health history, but my oral cancer screenings and really removed the biofilm, with these certain products. And I did it this way. And I got to like choose these things for my patients. And it just was really empowering to be like, man, this people should have way more access to oral health this way and prevention. Like when we don't have these options, we're really limiting ourselves in dentistry. I always like to say we're preventing prevention. Like we are the oral health professionals. We got to stop preventing prevention and hopefully bring more of this to patients who really need it.